for joining us for another episode of In the Know with the CSO. May is Mental Health Awareness Month, and we're taking a closer look at how the Chesapeake Sheriff's Office addresses mental health in our correctional center. Today, we're joined by Major O.T. Holton and Amy Luckinbill. Amy, can you talk about our inmate population and the percentage that struggle with mental health, and how has that changed over time?
We've had an increase of mental health individuals coming into the facility, both SMI clients, which are serious mental illness, as well as those suffering from depression, anxiety, PTSD. Has definitely increased. We probably at this point have about 70% of our population who have some form of mental health issues.
Why is mental health such a critical issue within the correctional center?
I would say the most important thing is working with our clients so that we can decrease recidivism rates and provide them the stepping stones towards self-sufficiency. So we also have discharge planners as well to make sure that our clients, the inmates, can continue to get treatment on the outside as well. But we've expanded our services to include individual therapy as well as group therapy. We just began last month.
And Major, can you kind of touch on how the Sheriff's Office deals with inmates struggling with mental health?
Sure. Mental health has always been an issue in the correctional center, but within probably the last 10 years, it's become much more prevalent. We've done things like when we negotiated our new contract to hire a new medical provider, they had more mental health staff than what we had in the past. Also, with Hampton Roads Regional Jail closing down, many more of the people are now staying at our facility. And as Amy mentioned, we've hired 4 new, they're called forensic discharge planners. And they help not only while the residents are at the facility, but when they leave, help them transition back into society.
And sir, is there any initiatives or programs that the Chesapeake Sheriff's Office implemented to support mental health?
Absolutely. The biggest thing we have coming is it's going to be our Mental Health Therapeutic Unit. Sheriff Rosado saw the problems that we were having, especially after Hampton Roads closed down, and he used our great relationship with the city manager's office, approached them and talked to them, and what we're getting ready to do. Construction's supposed to start any day now. We're going to repurpose a section of our building. We're going to go and we're going to take a unit that is currently what we call indirect supervision. So the deputies sit outside in an office and view the unit. We're going to actually build area for them to be inside so that it'll become direct supervision. So they'll actually be much closer to the guys, be able to interact with them more, but we're also going to build office space for the mental health staff. So they'll actually be in there as well. We're going to remove some beds, do some moving around, and create an area for activities for them where the group therapy can be done. I think it's going to be a great thing. It's going to be a great thing for the residents and for our staff.
And Amy, can you kind of talk about your role in this therapeutic unit?
Yes, I'm the mental health director. We're Vital Core at the jail, and so we worked very closely with administration to make sure we will have the right people in the unit as well as those who are trying to make a difference and change, and so we can give them those tools. Whether it's job readiness skills or anger management classes, we're going to be working with people more one-on-one as well as those groups. So.
And Major, what would you say the biggest obstacle to improving mental health is for incarcerated individuals, and how is the Sheriff's Office kind of closing that gap?
Well, I think the biggest problem is that before we just weren't equipped, neither with our facility nor our staff. And like I say, I think with Vital Core coming in with Amy and her staff and the repurposing that we're able to do in our building, we're not only going to make it easier for the residents while they're there, but also safer for them. And I really think that we've taken big strides. We're getting ready to take bigger ones.
Well, thank you, Major Holton, and thank you, Amy. Well, now you know. See you next time.